Well, good Friday morning, Northern Michigan. Of course, today kicks off Heart Disease Awareness Month. I want to introduce Dr. Shelly Lall. She's a cardiothoracic surgeon with Munson Medical Center. Dr. Lall, absolute pleasure to have you here this morning.
Thank you.
Talking about heart disease, the signs and the symptoms for both men and women. It is the #1 killer of both sexes. So starting with women though, which usually women have the atypical symptoms.
They do, and those atypical symptoms are more of some indigestion or heartburn. They can also be shortness of breath, nausea, vomiting, dizziness, also pain that goes down the arm, up into the neck, the jaw, and maybe into the back. Those symptoms are more common for women.
And at what age should women typically start to focus on heart disease, especially, let's say, if it runs in their family?
I mean, as early as possible. I mean,
Okay.
Knowing your, your BMI, your cholesterol number, all of those things, how much you exercise, all of those things can be started as early as possible.
What about the men? What about their symptoms?
The symptoms for men are usually more typical symptoms. So that's chest pain, usually in the center of your chest or over onto the left side. It can also be a fullness or a tightness, a squeezing sensation in their chest.
And when it comes to men and women, is one, men or women, is one more prone to heart disease than the other?
They're both equally as prevalent, yes.
Okay. And what about statistically looking women with heart disease?
Sure, so heart disease is the #1 killer. And within women, it's 1 in 3 women will die from heart disease. Men, 1 in 4.
For women, 1 in 3, men, 1 in 4.
Yes.
And those risks obviously will go up for, person to person depending on that history they have in their family.
Exactly.
And also the type of lifestyle they live, really.
Exactly.
What type of lifestyle should someone be focusing on to try to prevent any type of heart problems, stroke, anything like that?
Certainly, exercise and diet are 2 big things that you can change. You can't change your family history, you can't change other things like that, but exercise, diet, lower fat foods, all of those things help.
And one of the big things too that I think some people think, well, this can't happen to me. This isn't, that's not something that will happen, but really it's something that you need to be proactive about.
Yes, exactly. I mean, it's some of it is genetics, but some of it is just lifestyle. So if you need to really be conscious of the lifestyle that you lead.
And coming up a little bit later in the show, we're going to talk about heart screenings. And I just want to touch on that briefly, that it's a simple procedure that you can have done to really have a huge impact on your health and really know your numbers when it comes to heart disease.
Exactly. Knowing your numbers actually helps you because you're a little more conscious of what you're going to do. Are you going to sit on the couch and watch TV or go take that walk? If you know your numbers, you may take the walk. You may not have that second dessert, or you may, choose a little more wisely if you know your numbers.
Any final tips, Dr. Lall, for any women and any men out there who are watching this interview?
Certainly just work on changing your lifestyle, knowing your numbers, exercise and diet.
Really?
In terms of eating healthy, nutritious meals.
Really basic tips that could help lead a healthy lifestyle for sure.
Definitely.
Well, Dr. Lall, I want you to, of course, thank you for joining us. Please stand by. We're going to have more information with Dr. Shelly Lall talking about those heart screenings, how simple they are, and how you can actually get one at Munson Medical Center. There are some grants available. We're going to tell you all about those details coming up, so stay with us. But first, taking a look at weather this morning, here is Storm Team meteorologist Joe Charlevoix.